very much for the introduction, and maybe you're a bit intrigued by the title. It was actually given to me by John, but I can tell you, I never in a million years thought that either I'd be a professor of medical pharmacology or that I'd be speaking at a leadership conference. And it's kind of interesting because when I reflected on why I might never have seen myself as a leader, it's partly because some of the examples of leadership that stick in my mind are actually the bad examples. I don't shout at people. I don't make people cry. I don't micromanage. I don't bully people. I never explode. In fact, I can't explode. It was interesting listening to you, Chris. Sometimes I wish I could explode, but I've been told it's not a good thing. I'm thankful that I stay quite softly spoken, even when I'm very incensed. But one thing that really challenged me a good few years ago is I was at a CMF conference that I think quite a few of you might have been at. And somebody called Glenn Harrison, that many of you will know, was giving a talk. And he was talking really about changing ethics and moral standards. But one thing he said was that as Christians, we have to kind of get up there and tell a better story. It's not enough to say something's wrong and make disapproving, muttering comments. But we actually need to get up there and talk about why living a life for Christ is important. Because if you are a Christian, you're one of God's chosen people. You're called to be Christ's ambassador. We're called to be salt and light in the world, and we're called to speak truth to power. And so what I'm going to do this afternoon, I get the session straight after lunch. So I'm going to really do a little bit of storytelling. I'm happy for you to get in touch with me about any of these. Some of the stories are a bit raw, but here we go. Clicker. So in terms of what I do, I lead a research program looking at drug dosing and safety, particularly in pregnant and breastfeeding women. And the reason for that is that everybody deserves to have evidence to access for evidence-based information to inform healthcare choices. And so if we've never done a study in pregnant women, how do we know how to use a drug in pregnancy and so forth? So my work involves clinical trials, pharmacokinetic studies, lab work, mathematical modeling. But over the past few years, it's also taken on more of a sort of advocacy and public engagement slant. And through my work, and also through some of the stories I'm going to tell you today, I've taken on quite a lot of equality, diversity, and inclusion roles. And that's another area where I feel that as Christians, we do have a responsibility to engage and potentially tell a better story. What I think is so beautiful about diversity is that it is God-given. So God made us all in his image, but he didn't make us all the same, did he? I mean, wouldn't it be boring if that was the case? But he's given us all different personalities, strengths, but also weaknesses. And I think it's sometimes through those weaknesses and sometimes through that brokenness that God can work most powerfully through us. And I'm going to touch on some of those themes today. As I say, I'm going to go quite quickly and talk about a lot of things, but hopefully there's something for everybody. It was interesting listening to Mark talking this morning when he gave some examples of different leaders, because I love the story of Moses. I'm not going to read the whole story in Exodus 3 and 4, but he's just had this amazing supernatural experience. God himself has said to him, take off your shoes, for the place where you stand is holy ground. And then God says, go to Pharaoh and say that you want to lead the people out. And so does Moses say, fantastic, this is the leadership opportunity I've been my life. Well, not entirely. Who am I? Who am I that I should go to Pharaoh? What shall I say to them when they ask what your name is? But what happens if they don't listen? What happens if they say the Lord has not appeared to you? And God graciously answers him, gives him some miraculous signs. And Moses still, he's not had enough, but I don't speak very well. And my favorite part is when Moses just says, send anyone else. The reason I like that story is that the Bible is full of fallible people. And if you're in any sort of leadership role, I can guarantee that you're a fallible person, leading teams full of fallible people. So I think there's a lot that we can learn. So in terms of when I'm speaking at work, I often give a talk on kind of life-work balance, and I give a timeline of my life on one side and my work on the other side. And I'm going to use a similar format today. And usually at work, I start off by talking about how I got married in graduation week in 1999. But there is a bit of backstory that I don't always talk about. So when I interviewed for medical school in 93, I was 16 years old, I'd already been living away from home for quite a long time because of a social service decision, and it was the day before my mother's funeral. So there'd been quite a lot of complexity and turbulence and bad stuff that had happened up until that point. But for some reason, I ended up working in a mission hospital in central Thailand that summer where I heard the gospel for the very first time. Now, it's again, there are so many stories like that. You look back and you think, how did that happen? And all you can say is God is good. I heard the gospel, I believed it. I knew the joy of sins forgiven, and believe me, as Jesus said, the one who has been forgiven much loves much. And for the first time in my life, I knew unconditional love. And that was about a month before I came to a new city so I could immerse myself in church, CMF, Christian unions, a totally new life. Now, of course, it wasn't easy. People who knew me at the time, there was quite a lot of turbulence because these things don't go away quickly. And perhaps they leave their scars all their life, but that's part of what makes you who you are and makes you able to engage with certain people. Someone said it this morning that each of us in this room can do things that no one else can because of where we've come from. The other random thing that happened in 99 is I got this diagnosis of Ehlers-Danlos syndrome, which I'll kind of come back to. It becomes more relevant as the story goes on. At the time, I just thought it was random, explained quite a lot of the surgeries I'd had along the way, and so forth. Anyway, by the time I got my MRCP, I was pretty sold on that I wanted to do something in global health. At least I wanted to do mission work, and I thought I should be a surgeon or an obstetrician out in some remote area. But during one of my jobs, I had some appendicitis and it kind of affected my ovary and it was all a bit mucky. And at the end of that job, I got a reference that said that I was too physically frail to consider working in the tropics. So it sounds quite minor now when I tell the story, but at the time it was absolutely devastating because I felt like I was only just getting started. I'd overcome quite a few things, and now I'm being told that I can't do not just what I wanted to, but what I actually felt called to do. But one of my registrars, who I believe to be a Christian, he just said to me, look, Catriona, sometimes the only way to prove people wrong is to say nothing, but to prove them wrong. And one of my professors said, well, why don't you go out to Malawi? Why don't you see how you get on with your health and see if you can come up with an idea for a research proposal? So off we went. And what we saw was at the time before antiretrovirals were available in the public sector in Africa, we were seeing people younger than ourselves wasting away and dying of TB and HIV. So that was what I wrote my Wellcome Fellowship on, is why do people die on TB treatment? And those were some really wonderful years because for my husband and I first of all was fine in terms of my health, but we also were reflecting on how we can serve God. Because maybe sometimes you think the best way to serve God is through full-time Christian work, or you have to be a missionary or work in the mission sector. But we felt quite strongly called that we could serve through teaching and through academic work and through actually the secular workplace where all of our colleagues were not Christians. I mean, that was quite a conviction at the time. And whilst we were out there, we had our first child. So obviously we'd been married for quite a while by now, but on the one side of my family, there was this kind of, I'd only describe as an intergenerational cycle of addiction and abuse. And I kind of knew that those things can happen again. And I wanted to be really sure that I wasn't going to do the same thing. And on the other side, I had this Ehlers-Danlos gene, and the doctors had said, you might not even be able to carry to term anyway. So it was quite a risky decision. So there I was, and I was pregnant, and we started talking about going part-time. And as an academic, I was getting quite a lot of criticism for that at the time. People said, people aren't going to take you seriously, or just get a nanny and go full time and you can have it all at once. Now, I think that is one of the biggest lies that we get sold in this generation, particularly women, but men also. I do not believe that you can have it all at once. I believe there's always got to be sacrifices and compromise along the way. But that's just an aside. But with Eva, we didn't get the chance to find out because when she was 9 weeks old, for some reason, she went asystolic. And whilst we got a cardiac output, it was at the expense of significant hypoxic brain damage. And she died 6 weeks after that in Johannesburg. So I think it's important to say that tragedies, bereavements, life-altering diagnoses and events, they are going to happen, and they will happen to all of us at some point. The Apostle Peter wrote to the persecuted church about trials. Why do you act as though some strange thing is happening to you? But Peter also wrote that these have come so that your faith, which is of greater worth than gold, which perishes even though refined by the fire, may be proven genuine and result in glory and honor at the day of Christ. I think it was Corrie ten Boom that said, sometimes you don't realize that Christ is all you need until he is all you have. And during those days in Johannesburg, that was very much the testimony of my husband and I. Another powerful lesson this taught me was that we don't know what tomorrow brings. And Jesus himself said, do not worry about tomorrow. Each day has enough trouble of its own. But instead, whatever you do, you know what you've got to do today. Work at it with your whole heart, because you're working for the Lord and not for men. And I find that a very liberating way to live. Yes, as a leader, I make my 5-year plans and I make these projections, but I hold them lightly. And I think it gives you the freedom to dare to dream, perhaps a little bit bigger. Anyway, how do you move on from there? Well, a year later, God blessed us with a son, and when he was 10 months old, we adopted a 4-month-old baby who promptly had his own near-death experience. You can see him, he's recovering there with a little green needle in his bone marrow. He did exactly what my PhD showed that you could do. So when you've got disseminated TB, your monocytes, your innate responses they become down-regulated. So when you get a second pathogen, it's that can kill you. And he nearly died of bacterial sepsis. But 6 months of TB treatment, broad-spectrum antibiotics, and he didn't see a doctor for another 11 years until last week. But at the end of that time, my husband and I both went part-time, and we have been part-time ever since. And I think the fact that he did is the more important part, because it's quite normal for a woman to go part-time. But for a man, you often face more prejudice, and are you serious? So there we were. So we had these 2 little boys, very close together in age, our hearts utterly overflowing with thankfulness. And what we thought about that time was we weren't really seeing the role models we wanted to see in the academic sector. We weren't really seeing people that seemed to have a healthy life-work balance. And we also kind of realized that we probably would end up doing jobs that didn't yet exist. So my husband, I mean, he's got about 5 part-time jobs. He runs a viral hemorrhagic fever unit in Western Uganda. He works as a consultant acute physician in Liverpool. He's a freelance GP. He teaches in the medical school, and he's on a couple of clinical trials. But we're both part-time, and between working, we homeschool our children by choice, so that we can move around the world, we can move around countries, and we just kind of pick up where we've left off. And we hope that perhaps we're providing some healthy balance for the next generation. But I went back, finished my PhD, and then I blinked and I was pregnant again. But this time it was me that got incredibly sick. And to be honest, it was only a matter of time. So I'd had previous fundoplication surgery and had hyperemesis, and it broke, and my stomach ended up here somewhere. And I got so kind of malnourished, I picked up all kinds of opportunistic infections. And I was just in hospital for months. And that was actually one of the hardest times, because all the other things had been things that happened to me, but this was like within. And I just felt, there were some days I felt like I was going to die, and I almost didn't care. And I'm actually quite glad I went through that, because everything you go through gives you a greater empathy and compassion for those around you. And I don't think I'd known what it was like to feel just so hopeless. But when the baby was born, everything except the vomiting got better. And then I had to face the fact that my actual research wasn't going the way I wanted, because I was doing a lot of cellular stuff that was moving further and further away from the patient. But like most people in the room, I went into this because I care about people. And so I decided I'd go back into full-time clinical medicine. I do acute medicine. And I was sitting one day breastfeeding that baby in my professor's office, and the baby was sick. And you can imagine all the mess. And we somehow got talking about how difficult it must be to measure how much drug gets into a breastfed baby when it's the mother that's on the drug. And I had thought, well, maybe for antiretrovirals, that must have been studied. But I went home that night and there was only about 19 papers and most of them were pretty poor. So I rapidly wrote a grant application on that. And then we went off to Gambia. Now, it's a bit of a random thing we did, but my husband took the last 3 months of maternity leave and I took the accrued annual leave. And at that time, Karen Forrest, who some of you may know through CMF, she was running the Sibonor clinic and she needed someone to cover her wedding. So we kind of went as a doctor and a spouse and shared the doctoring and the spousing. And I mention it for 2 reasons. One being that you can be very creative of how you use your leave. If you want to dip your toe into something different, think about using some of your leave to do that. But also it kind of reconfirmed to us that we could do the mission hospital thing, but we felt called to the academic sector. And it was whilst we were in Sibonor that my Academy of Medical Sciences starter grant got funded to look at antiretrovirals in breastfeeding mothers. Then after about another year, I finally had the surgery that I needed to stop this vomiting that I'd had like every day for the last 2.5 years. And the reason I mentioned that is that I win prizes for communication. And yet when it comes to my own health, I cannot advocate. And I've been trying so hard to get medical attention. I had to wait a year for a test. It involved a tube that I vomited out. I had to get put back to the bottom of the queue. I was writing to the chief exec 4 times. I wrote to the chief exec. And it wasn't his fault. He was just there. But eventually the surgeon saw that I was getting pretty sort of weak and took me to theatre. And it was just like I said, it all broken and he fixed it. Now, this Ehlers-Danlos syndrome, I've mentioned it a couple of times. It's a collection of connective tissue disorders, one of which is fatal, and that's not the one I've got. So most of the time it's more of a curiosity. And the reason the symbol is a zebra is because of this story of medical students sitting in a room and they hear some hoofs going by and they say, aha, clearly a zebra. And most of the time it feels like a curiosity. You know, I'm running there in a game park with my son. But there's other days when it feels a lot more like this. There are some days when the pain is awful and I feel sick, dizzy, muzzy-headed. And of course I look exactly the same as I normally look. So unless I was to tell you, you would have no idea. And for so long, I was so ashamed of having this physical weakness, probably because of this comment earlier on in my career that you can't do the job you love because you're a liability or whatever. But I came to realize that there are many people on your team, many of your juniors that might be facing something that they've never been empowered to speak about. So actually, as I get more senior and I'm in a more safe position, I do talk about it sometimes because I feel that if I can be open about my own weakness, then maybe my team members can too. Because there's nothing worse than being in a situation where you feel like you're about to pass out and you just can't tell anybody. Anyway, it's another of those situations where obviously I wish it wasn't there. It's like the Apostle Paul, 3 times I pleaded with the Lord to take it away from me, but his power is made perfect in weakness. His grace is always sufficient. And I feel like this does keep me trusting God. It keeps me hopeful. And there are times when I just have to say no to things. Anyway, whilst I was recovering from that surgery, I got another welcome grant and off we went to Uganda. And we got a couple of other clinical trials looking at different drugs. And so time went on, and because things were stable, we thought it'd be a really good time to have another baby. And you'll be really glad to know nobody got sick. But we did have about 3 years of quite complex visa and immigration challenges along the way. But then really, from that point on, things started to take on a little bit of a life of their own. So somebody had said to me earlier in my career that you have to find that purpose. You have to find that one thing that you can't let go of, that you're just so interested in. And for me, TB immunology had not been that. It was interesting. But this question about drugs and pregnant and breastfeeding women, so it brought together everything I felt passionate about. So as a mother, having had some very sick babies, having been an ill mother, but also as a pharmacologist, I could bring my skills into that area. And sort of this niche opened up that actually, personally and professionally, I was ideally qualified for. And you start to see how God has brought all of it together. And I'm sure there'll be some of you that are in slightly different situations where you can see how God has opened up doors for you. Because when you speak with passion, people believe you. And I started to be invited to talk. And every time I was invited to talk, then I get invited to join another committee or this or that. And more grant applications, some of them sort of a couple of million. And then I also started to move more into this equality, diversity and inclusion side, partly because at the very center of my work is equality of access to research, but also because of this thing to do with careers, that I don't look like your typical leader, or at least the stereotype I had had of a typical leader. And what I always want to be able to do is encourage people that you might not look the part, but that doesn't mean that you're not equipped to do it. It doesn't mean that God can't use you. It doesn't mean that you can't have real impact within your sphere. So time went on, and I suppose with these great bigger grants and opportunities came some promotions. In 2020, finally adopted my daughter, got British citizenship, which meant that we could move back and forward seamlessly between countries. You can see a nice normal looking picture of us in a park during lockdown. And I got another welcome grant that kept us in Uganda a little bit longer. And really, time went on this year, I was promoted to professor. And as a little bit of an interesting twist in the story, the baby that had TB, not having seen a doctor for 11 years, has just been discharged from Alder Hey with brucella. And whilst I was sitting in the hospital, I was in for 12 days with him. I was wondering about whether I was even going to get down here. And I was feeling overwhelmed by emails piling up and things I couldn't do, and just the exhaustion and just that question of why. But that made me also think, actually, everything I've said up until this point, it still stands, because we mustn't worry about tomorrow. We need to take each day as it comes. We need to take every opportunity given to us and take each day trusting God. And that's how we live. And praise God, he's home and he's improving. So why have I just done this? Why have I just stood in front of a room of strangers and people online and told you about some of the darkest and most challenging times in my life over the last 30 years? Well, the reason I've done so is because I think it's important, because each of us has a story. Each of us is unique. And I don't think everybody has to stand up in a room full of people and tell their story. But I think you can start to see how God has worked through you and equipped you in different ways. I also feel that if I can be vulnerable in some ways, it can encourage my team around me to be. So over the last few years, I've experimented with different models of leadership. And the ones that we always think in our minds are the very dictatorial, sort of commander style leadership of standing, giving instructions and being very strict. But actually there are different models, and there's like more democratic ambassadorial models of leadership where you seek the views of your team. And actually for me, working in a cross-cultural setting, it's actually often more appropriate that I delegate a lot to my team members, particularly when it comes to working with government parties and so forth. I need to be advised on protocol and such. So coming back to where you are today, there might be something that you're thinking of doing, or an opportunity, or something your mentor has suggested, or something you're quietly feeling convicted about that you don't want to do. And I wonder whether you're like Moses, whether you're making quite a lot of excuses. So are you saying, I'm not from the right background, you're too old for this, most of you now, but I didn't go to the right school, I'm not from a certain privilege. Believe me, especially when I was younger, I have been in rooms where I have felt that I have not belonged because I didn't go to the right kind of school and come from the right kind of background. But that doesn't have to be a barrier. Is it that you don't feel very confident? You don't feel that you're a natural leader? Well, believe me, I have never felt like a natural leader. It's just that you have to realize that sometimes you're leading whether you want to or not. You are leading, but it's a question of whether you embrace that and do it well. And things like confidence, coaching, mentorship, all these things can help. Have you had previous failures or rejections? I think many of us have. Anybody not ever failed? Yeah. Have you ever been told something's impossible? I actually start to laugh now when somebody tells me something might be impossible. I actually find it quite funny, because the number of times it'll be impossible to combine a career with family life. It'll be impossible for someone like you to work in the tropics. Welcome won't give you money if you're part-time. They won't take you seriously. Nobody can get promoted up to professor whilst being part-time. You know, nobody can homeschool their children and do this. But yeah, okay. But maybe if it's right and it's what God wants you to do and needs you to do, for the role he's called you to, maybe it's not impossible. Do you need more training or mentorship? Well, I think that's why many of us are here today for these networks. I think CMF has been immensely supportive. Like the previous speaker, I have not been paid to say that, but sometimes in our churches, people don't really understand what we do. And sometimes at work, people don't understand our faith, but CMF brings that intersection together beautifully. Is it that your family life is busy? Well, probably the people you lead also have busy family lives, and maybe through you being a bit vulnerable about your own juggle, maybe you can help your colleagues. Is it that your health isn't perfect? Well, depending on what it is, that need not be the barrier you might fear. So as I finish, I just really want you to stop and ask yourself, what is it that God wants you to do today? Thank you very much.